was always my vision to optimise my patient's outcome through addressing the root cause of their problem. David Johnson's my name. I'm a brain and spinal neurosurgeon. Around sort of 2014, 2015, I realised as a spinal surgeon I was fixing up the symptoms of a disease which I refer to as movement dysfunction. There was no rehabilitation methodology that addressed movement dysfunction. And so as part of my practice I felt the need to develop that form of rehabilitation and set the blueprint, so to speak, for how to help those patients. And the natural progression was to have it in the hospital, so that patients could then have their surgery or whatever treatment was required, whatever symptom-based treatment was required, and then transition directly into the cause-based therapy. And it was wonderful to be able to do someone's operation on one day, and then the next day say, right now it's time to begin your rehabilitation to actually address what caused you to require the surgery in the first place. And from that moment on, it just grew organically because of the effectiveness of that comprehensive treatment plan. The quicker we get someone moving after surgery, the quicker the healing process can occur, because I perceive the movement to be the therapy, the medicine. So if I perform a surgery on someone, or even if someone's in hospital with severe pain and disability, they're not actually beginning to heal whilst they're lying in bed. They are controlling the symptoms at that moment, but if they are not then progressing towards proficient movement, the actual seed of their problem has not been eliminated. Just kind of sweeping the problem under the carpet, and they may feel transiently better after the symptom-based intervention, but that is very short-lived, and they'll go home, yes, I feel fantastic, but they'll come back the next day with the pain returning again, because the actual problem, the monster that's still causing it, has not been eliminated. And that's what I really refer to as the paradigm shift that needs to happen globally, not just in Brisbane. And we know that musculoskeletal pain is a huge economic and clinical burden in the world. There are roughly 15,000 boxes around the world that are delivering functional movement therapy to their athletes every day, and that is an extremely powerful asset, but it's not being utilised in the clinical setting, and that's sort of what we're doing here at CrossFit Neuro. Is we're transforming what every box in the world is doing for athletes, and we know that CrossFit and functional movement is developing the fittest on earth. We're transferring that same blueprint into a clinical setting. That was our third community-based seminar. We do education programs for general practitioners. When we have special guests, we had Dr. Aseem Malhotra come to Brisbane not too long ago, and we did a community seminar about cardiovascular health. And it had been a little while with 2020 restrictions, and it was really nice to deliver a seminar for the grassroots community-based target audience, talking about what I refer to as pillars of health, and those pillars of health being quality movement, quality sleep, quality nutrition, and stress management. And so we had experts in the field, all clinicians, a psychiatrist, a well recognised and respected psychiatrist, Dr. John Paul Koo. We had an endocrinologist talking about nutrition and insulin resistance, Dr. Kevin Lee. I spoke about movement proficiency and movement dysfunction from my experience with spinal disease. And we had a clinical research professor talk about circadian rhythms and circadian biology and the importance of sleep, which, when you look at those four things, I believe that if you can master those four pillars, that sets the playing field to build your health upon. Thinking about the basics, those four pillars, everything else just falls in place. You just don't get afflicted by chronic disease. And I think in medicine today, 90% of disease burden is preventable. 10% of disease is accidental, poisonings, infections, those types of things are unavoidable, but that really represents 10% of the medical burden of disease. The other 90% is entirely lifestyle and preventable. Yeah, let's do it from the ground up. You've got 100, 200 members in your gym, and if you can educate those members, there's an incredible orders of magnitude exponential potential to disseminate that information. And before you know it, the community demands better care. And it should, that's the sort of bottom-up approach, grassroots approach. That's the beauty of CrossFit. It's got an incredible, loyal, devoted community, and as such, a very powerful community.